Good morning. Thanks for joining us again on the second day of Engage. Whenever I'm talking to doctors or entrepreneurs or bureaucrats or whoever, I always, about new ideas or new products or new policies, I always ask if they've talked to patients. And I say patients are a really good reality check because you have your ideas, but then there's reality. And if you haven't made that check-in, you might be pursuing a really bad path. So another thing that's good about my job is that I am a patient sometimes. I'm fairly healthy, knock on wood, so I'm not always dealing with a doctor, but recently my OBGYN closed her office and was going to move across town, and I was not following her. And she wouldn't give me my records. I'm like, they're my records. I'll come copy them. I'll fax them. I'll copy them myself. Look at my records. So Ramin and I met in March at a meetup that was called Hacking Healthcare. And he started talking about access to medical records. And I said, I need your help. And so we've talked several times since, and he's been doing a lot of great work with CupidMe, which is helping people get access to their STD testing records. And having experienced how difficult it is to get any health records, I could immediately see the applications throughout healthcare for whatever records you were trying to get. And Ramin proved to me, I'd heard that faxing was still a big deal in healthcare, but I didn't want to believe it. But we're talking with him about CupidMe made me realize that it's still the way to communicate. So in his work for the last 2 years building the company, he's researched laws relating to access to medical records in all 50 states. So he really does know a lot more. And I felt particularly frustrated myself because I'm like, I'm a journalist. I should be able to figure out what's the law. How do I get my records? I know it's my data, but I didn't know how to get it. And so I just stopped because life was happening and I didn't need my records. So today we're going to talk about HIPAA and how access to data can help patients take care of themselves better, and how dating has moved to the iPhone, or to phones in general, and what that means for access to health records, and again, helping people take care of themselves. So, Ramin, you said that one thing that you've dealt with is a misunderstanding of HIPAA, what the P really stands for in the law.
Yeah, it actually stands not for privacy, but portability. And a lot of the healthcare providers we work with don't know that, right? Because the people you're dealing with are on the front lines. And we've spent time at the healthcare clinics, and especially STD clinics, to see how the front end office people work on these things. And they just want to make things go fast, right? And the only things they respond to are faxes. It's almost like an email to-do list, like when you get emails, right? It's the same kind of thing when faxes come in for them. But they aren't as knowledgeable about the changes that's going on that we are in this room. So you want to make things as easy as for them as you can. And fax seems to be the best way at this point to communicate with them still. I think there's 15 billion faxes sent in the medical healthcare system every year still.
And you said that providers often err on the side of caution, like, I don't know what I can release, so you can't have anything. You've run into that several times. Yeah,
we run into that too. Tiny little clinics that do STD testing, all the way up to Stanford University, for example, that won't release patient records the way they're requesting. And it's incredibly frustrating, right? We spend a lot of time in our service. We want to help people make better decisions before they have sex. In order to do that, they have to have their health records. Then we verify them when they're sent to us. But in this case, you have universities that just don't respond, right? Or they will tell the patients, the students in this case, we're trying to protect your privacy, so you can't have your records. They'll offer it to them in other ways sometimes, or sometimes they just won't respond at all.
And you said that some organizations have privacy policies that haven't been updated for 10 years.
Yeah, there was one particular case in San Francisco where actually the city clinic, who does amazing work when they test you, where our users had requested their records on multiple occasions, and they cite their privacy policy as why they can't release it, and it's against HIPAA, right? But then I tell them that their privacy policy is from 2003 on their website. So they haven't actually had an update in a while, and a lot of things have changed. We know they're doing important work in a lot of ways, but giving patients access to their records is just as important.
And it seems that some providers are looking at it through a certain lens of what they think people should be doing or shouldn't be doing, or there's sort of this unfortunate transferring of morality, or they look at the world one way and they think everyone else should, and that's affecting access to data.
Yeah, it's incredible. We never, stupidly, I didn't think that would happen, right? I thought the doctors wouldn't judge that their users want to share their STD results for whatever reason they choose. So we've heard of doctors, and they've actually written this, right, where they won't release the records because they disagree with what CupidMe does. So they won't give the patient the access to records purely because they think it'll be a digital tattoo and all sorts of other interesting things there, right?
The interesting part about CupidMe is that you sign up for an account on the site, and you make a records request, and you send it through electronic fax to the provider, and then you can get your records back, and then you can actually share that information. You can pick people to share that information with. So I could see on my phone, oh, I got tests for various things, and I'm clean, and here's my test, here's the date on my test results, and so it builds trust between people who may be hooking up.
Yeah, you're holding them accountable, right? It's almost like Uber, the car service, right? You have all this data that all these different taxi cabs and black cars are driving around, but there's no way to kind of, they just don't know how to kind of all come together. And there's this information that's static. We're bringing flow to this information that's just sitting there. A lot of people never get their test results, right? A lot of times when you go to your doctor and you get tested or something, you hear, hey, if you don't hear from us in 2 weeks, no news is good news. And I hate hearing that, right? Especially if you're getting tested for STDs, that's not a fun thing. We want to eradicate no news is good news by helping patients have access to their records in a much faster way.
And you've seen some behavior change among some of the users, or how frequently people have been using the service?
Yeah, they're actually our users are finding that the more often they get tested for STDs, the more attractive they become in an online dating environment. So there's 50 million Americans dating online, and the more recent your test date, and it signals something, right? So for the first time you actually have that information in a verified way, they can show this person was tested at this particular date. So we actually see our users getting tested more often because they want a more recent test date, which is a great change in behavior.
And I think another hallmark of a good startup is taking feedback from your users and doing something with it. And you said that some people have requested to have HIV viral load as part of their results, because the lower your load, the better you're taking care of yourself. Is that right?
Yeah, absolutely. So there's a lot of stigma around STDs, especially HIV. What we found is our HIV positive users want to have sex just as much as anyone else does, and they should have the right. So if you take your HIV medication, your viral load goes to a point that's called undetectable. Like Magic Johnson, for example, has had HIV for 20 plus years, but he takes his medication, so his viral load is low enough to where if he has sex with someone else, the odds of transmitting are reduced by 96%. So it's this kind of information that brings more transparency to when people are dating, but they have to actually have access to the records to do and get this information. And we've had a lot of trouble with helping patients get their HIV positive results.
I think that I have an 8-year-old and a 4-year-old, and I've already started thinking about the sex talk and, what am I going to say and what will I do? And I think one thing that's so great about CupidMe is that it just sort of brings the topics out into the conversation. It's just sort of matter of fact. Maybe we're certainly not to the point where it's as common as this is my A1C level or this is my blood glucose level, but I think it's really refreshing to get these sort of sensitive but very important topics out. And CupidMe has recently announced a partnership with the LA County Schools, which is a whole bunch of kids.
Yeah, they have a couple 100,000 students, and they saw the importance in empowering the kids to not only get their STD results in an efficient way, but also to actually have them sharing that information. And they want to empower the students to know that they have a right to talk to their doctor and to actually get their information. In California, students can be as young as 12 years old, or anyone can be as young as 12 years old to actually get tested and get their results without their parents' consent. So we're seeing younger and younger people requesting their records, which is empowering them to know that they actually have some control with their doctor.
We've talked a lot today about behavior change, and I talked to a lot of corporate wellness programs. We're going to get people to do this or get people to do that, and at a very basic level, you want people to not eat junk food all the time and to not be a couch potato. Those are sort of the lowest bars of health. But having access to your records and being responsible about your health, this seems to me to be a way to get people at a very young age, right? If you can ask your doctor when you're a teenager for your medical records, that's a pretty engaged patient, I would say.
I think so. We want to make it fun, right? I mean, they don't think about it, I think, at that age of being an engaged patient. They think about it as we want to get laid safely, right? That's the way that you kind of make it more interesting and fun. So you talk about it in different ways, in different contexts. It's like our tagline is spread the love, nothing else, right? We don't try to scare people into doing things. And we see it works a lot better. We'll have an app coming out where an iPhone starts kissing up on another iPhone, and that's how the actual results are transmitted, right? When your iPhones are actually bumping. And it's those kinds of things that we think help people understand that, yes, I want to do this, but then also I need to get my records in order to do so. So they're going to fight a lot harder to get their records.
I wanted to leave plenty of time for questions. It's an interesting topic and a lot of interesting research over the last 2 years to understand the ins and outs of the process. Are there any questions in the audience? Ramin and I can talk all day about access to medical records, but I thought maybe someone out there might have a question.
There's one on the left.
I have a question.
Here's the mic.
My name's Monica Gilbert. I'm an entrepreneur from Philadelphia. Quick question. Help me understand the business model. Who's paying to use this, and what's the incentive for them, other than obviously the information?
Right. So one of the, CupidMe is broken down into 4 things. The first thing we do is we help people figure out where the best places to get tested. So we're curating a database and a locator of where to get tested, and we've got the entire state of California and other select cities. The second thing we do is we help people access their records and online in the easiest way I think that we've ever seen in the country. They just sign a form in 3 minutes and then a fax goes out. The third thing we do is we help them share the records. The fourth thing we do is remind them when to get tested again. So where we make money is on different parts of that cycle. In one case, lead gen to healthcare providers who do a lot of STD testing. STD testing is about a $10 billion business. So there's a huge opportunity for us to actually be the one place where you can figure out where to get tested. And then there's advertisers that have been interested, drug companies have been incredibly interested, especially when it comes to the viral load part of HIV. We also verify if someone's been vaccinated for HPV, so there's lots of different opportunities along that. But we mainly want to work with clinics in the future to help them eradicate no news is good news.
Any other questions? I don't see any questions. It sounds like, we've been sort of bashing on the doctors and the providers, but by taking over some of the communication with patients, you could actually save clinics and doctors time of, yes, you're really all right. You didn't need to come back. It's okay. Here's your information.
Yeah, what we hear a lot of times is the doctors say no news is good news because it's the best way for them to deal with it. And because they're, for instance, the LA County Health Department sees 100,000 they do 100,000 STD tests a year. And it's impossible for them to get all of that information out to everyone. So they say no news is good news. But inevitably what happens is the patients come back, they wait another hour and a half, then they take up the doctor's time for some more, all because of HIPAA not being able to actually communicate the information. So we've kind of hacked HIPAA in a way that we figured out ways where this can happen in a fully HIPAA compliant way. And one other thing that we haven't talked about is we're starting to, I'm sorry, there's a question. You got it.
I'll just speak up. My name is Betsy Weaver, and I'm the CEO of TPR Media Ubicare in Boston. And I'm really interested in good sources of HIPAA information and pockets where they're not back 20 years, along when it first came in. One of the things that happened in 2007 was that there were questions and answers which established the fact that you could get information by email, that was okay. And there was then other questions and answers that confirmed that it was okay under HIPAA, that it's all right. You don't have to get a specific separate approval if somebody wants to get information by email. But no one in the United States in hospitals seems to know that. And my experience is that we can't find good information that hospitals listen to that supports the fact that you not only can but should communicate electronically, and also that you don't need a separate permission to do that. So for example, if I wanted to send you information by email, I don't have to ask you specifically for permission if I'm your care provider and I need to get you information. Do you have any good sources, good HIPAA sources, and good, do you know of any hospitals or clinics that really sort of get it and are in the forefront of interpreting HIPAA the way it now should be?
It's a really good question. Yeah, there's certainly good sources. One is maybe just my attorney, right? He knows where all these come from and focuses on these things. But what I found out is the policies are right? There's good things in place. There's no teeth to back them up. So if you actually send that kind of request to a healthcare provider, they're not going to respond, and they're going to cite HIPAA, and that's it. And then you're fighting with them for however long you're fighting with them, right? And you give up. And a lot of them don't even have the email access. But the policies are right. Nothing needs to change there. It's the actual policing almost of who's not doing what. So one of the things we've found out, a solution for us is we're crowdsourcing non-compliant healthcare providers with regards to HIPAA and a patient's right to records. So what that means is when you go onto our locator and you want to figure out where you want to get tested, we'll be able to indicate on our locator in about a month or two, does this place respond to your records? And if so, how long does it take them? In California, they have 15 days to respond to a request you make by way of CupidMe. The maximum in the country is 30 days, and then Puerto Rico is 5 days, and it's all over the gamut. But a lot of them don't even know this. So we're hoping to actually hold them accountable by crowdsourcing that information. And we've talked to people at the Office of Civil Rights who actually are in charge of compliance of these kinds of things. And they're incredibly interested in data that we have over the last 2.5 years of non-compliant healthcare providers all over the country. And they're fined, they can be fined up to $100,000 per non-disclosure. So I'm sorry I don't have a more specific answer for you. But these providers, they're doing so much and they're doing really important work and they're good people. It's just hard for them to do this additional piece of actually getting patients the records in the way they request.
Thank you. And state laws are different too, right? You said some states specify that doctors can charge a fee for records, but they don't say what the fee should be.
Yeah, we also have a breakdown of that, and it changes. It's not fun to deal with, right? And with HIPAA, it's the most restrictive restriction restricts. So if state law is more difficult, then you have to actually adhere to that. So we have this actually all broken down on our site. So whenever you use our service in any way, and for right now it's obviously just STDs, but as we go into other parts of medical, other things that we'll start verifying, it'll just be clear. As soon as you say you're from Arkansas, you'll instantly know what your patient rights are. And even a part of our site, we say these are your patient rights. And we incorporate them in a way that doesn't sound overwhelming. It's just like, oh, here's a clock that goes backwards until your records are due back to you. And if they're not due, there's a red button you can press, right? And we joke that it's almost like the opposite of the blue button is the red button, where you can actually report a healthcare provider, and we'll help make that happen within one click. Yeah. The idea being that you can do a complaint, just like Yelp, right? You can leave a negative review, but in this case, you can leave it anonymously. Because a lot of the fear is I don't want my doctor to get pissed off at me because they may not treat me anymore when I get sick. So you can leave it anonymously, but we know you've requested your records from that provider, so you or someone who's actually dealt with them. And then the other part of it is we can make it a one-click where you're actually filing a report, a complaint with Health and Human Services, Office of Civil Rights. And once they send the healthcare provider a letter, then they're listening. So we want to empower patients to actually have these tools so they can actually get their records, which we think eventually will lead to better health.
So, hi, Shauna Koss with Connected Health Resources. Sort of two-part question. For the target population that you are engaging right now, do you have sort of the next application that will sort of sustain them as engaged, and what kind of end benefit can replace the getting laid impetus? And then if you flip to sort of the chronic care needs of adults, have you thought of any innovative incentives that might get them more engaged in wanting their information?
It's a really good question. So far, there's nothing that stands out as clearly as getting laid, like you said. It's the one use case where someone really wants their records in a timely fashion. We have users saying it's on a Tuesday and they're requesting their records. They're like, I have a date Friday night. Like, I need to get these by Friday. And it's just, right, in that case, it works really well. And for us, it proves out, empowering people to get their records. But the thing after that is maybe chronic cases, right? Or you talk to patients like me in their different communities of what kind of information they want. But we don't have a specific use case now. We're laser focused on this particular part. But what we're noticing is our existing users very much want their other records as well in this fashion, right? You want to make it as easy as signing up to buy something on Amazon. Oh, okay, so you've already used CupidMe, my signature's already there. Well, I also want to get these 3 healthcare providers. Just click one button, I want to get all of those records as well in one particular place. So in some cases, we're almost like a PHR, although we don't really think about it that way, right? We want to help people have actionable information that will help them make better decisions.
So if I might, just because we didn't talk about this, how are you initially in identity proofing your population? Because that's always a challenge.
Yeah, absolutely. So especially for us, it's more difficult. But so when you sign up for the service, you give us some basic information about your name, right? And then you're actually signing with your mouse a HIPAA authorization form. The way it happens is you sign up for the service, we auto-populate for you a valid HIPAA authorization form requesting your records from your healthcare provider. You sign that with your mouse, and electronic signatures are legal, even though a lot of healthcare providers tell us they're not. They actually sign that, and then you hit send, and a fax goes off to your healthcare provider. If they have, and you also put your as your unique identifier your date of birth. So date of birth, your actual signature, and then the healthcare provider has to verify that the signature is the same that you have in the office. If they have any issue, they actually call you, because we have your number as well. And then those are some of the ways we do the identification.
Hi, my name is Doug Nagley from Infield Health. I wanted to make a comment instead of a question real quick, which is when we have gone to providers and pitched new solutions, and inevitably someone brings up a HIPAA objection, it's almost always not an attorney that's raising HIPAA. It's either a product manager or a clinician or a revenue manager. And we have found that we try to get their legal department involved really quickly, because usually the legal guys are like, it is HIPAA compliant if you just do X, Y, and Z. And it turns out X, Y, and Z is not really a big deal. And everyone's room's like, oh, yeah, we can do X, Y, Z. So anybody that's making technology, if you get their legal guys in quickly, sometimes you can figure it out. You can also figure out if they're going to say, no, we'll never do it. You can move on to the next customer.
We see them erring on the side of privacy every time, right? All healthcare providers, even us as patients and people, are taught to keep our records very close into ourselves. We think that openness in this case, in a way that you can securely share, is a lot more valuable. But I have an opposite example with a university, a prominent university, who sent it up to their legal department right away. I was thinking the same way you would, like, oh, they'll understand, this is what they do. They actually came back and said that digital signatures are allowed. This was their big complaint. Digital signatures are allowed, but their policy hasn't caught up with the law yet, so they're not going to respect the request. Right? I mean, legitimately, I hear these stupid stories all the time that drive me nuts, which is why we can't wait to actually do the crowdsourcing part to hold them accountable. Right? I don't think the threat is going to be less about us, one patient getting really upset, but it's going to be many patients coming together and saying, give me my damn records.
Crowdsourcing is a very interesting way of applying pressure. John Harris Shapiro from Continuance Health Solutions. The other way to apply pressure to a system is economics. Which crowdsourcing is an indirect form, most healthcare is provided or paid for ultimately by an employer or a health plan. Are you working with any of the benefit plan administrators as a means of pressuring providers to release this information?
Not yet.
It would be an interesting benefit for them to provide this service.
I'm sure my team's writing it down as you're speaking.
Okay, good.
I mean, just in terms of other applications, I mean, if you have kids and you've moved a lot, I mean, if I could make one request to 4 providers and say, did my kid get the shot, or if you have chronic conditions, I can see so many applications. That's why I was so interested in talking with you. And then no one's done this, right? There is no site you can go to say, what does Indiana say about HIPAA? Or you have to dig, and it's hard, and it's painful, and so you all have done that work, which is the work. No, it's kind of like Athena Health. He said it at Datapalooza. We do this gut work that everyone hates, but it's really important work. It needs to be done.
Yeah, I don't think there's anyone in the country doing it better than us, because every single day we're fighting with healthcare providers to understand how to communicate better to make sure we can empower patients to get their records. And it's we're not a Kaiser that does it all, many to one. We're starting with the bottom up and helping patients get access. And we know the bigger people, they're starting to pay attention already, actually. But we want to make it an easy process, right? And I think it'll impact health in a big way. And we're actually seeing doctors, I'm sorry, there was a question.
Hi, Leonard Kish with HL7 Standards. There's a question on Twitter. Do physicians have a way to respond to the red button report that is submitted?
They will. We haven't released it yet. That's coming out by the end of summer.
Okay, thanks.
It's a good question. We're seeing patients actually go to different places because their doctors aren't releasing their records, which is an interesting thing. So that's also an economic hit to them potentially.
You have been amazing at being out there and edgy, and I got to first see you speak in 2010, and I love where you've gone so far. I was wondering, as you go deeper in addressing things that people often do not talk about, have you thought about going into the end-of-life sex? Which unfortunately at this point, if you're at that stage, they just hand you a pamphlet and say, this is what we think you might be able to do. So, how about something like that in your social community?
Absolutely. I mean, there's all sorts of applications that we've heard about that are mind-blowing. How about that?
We have just a little bit of time left. Any other questions? I think there's one up here in the front. Yeah, I think she has the mic there.
My name is Pat Fiddler. I'm from Minnesota. My question may be a stupid one, but it's my question, and I'm wondering about the ability to use a record that may come out of Minnesota if you happen to be in California and you need somebody who can import your record into their system. You sound like you've solved that problem, have you?
Importing the record into another EHR?
Yes.
We haven't solved that problem yet, but it's something we can absolutely do. We'll be able to do soon.
Soon being?
In the next couple of months. Again, I'm sure the team's writing it down as we speak.
Okay.
They're somewhere out there.
Thank you.
One thing I would say before we close, I think we're out of time, is I'm not in the dating market, but Ramin has knows a lot about what's going on and how people relate to one another and how people connect these days. And so if you have a young person in your life, it's worth it. Once you understand how people meet each other, just to hang out and go to the park or have dinner or whatever, this is a natural step to fitting into the way the dating world works now, which it was a surprise to me.
Yeah, it's there's more dating done on your iPhone now than there is on a desktop at home. So the numbers are overwhelmingly now on your phone, and all the phone dating is actually geolocated. So you actually turn on your phone and you see who's around who wants to hang out or hook up. And I think that was pretty shocking when I shared it. But that's how people are meeting more and more now. And there's, again, 50 million people dating online. So CupidMe becomes more relevant because it actually shows your test date, if you choose to share it, on there. So people are becoming more attractive when they have a more recent test date, which is actually, the way we talk about it is impacting behavior. The way they think about it is it's helping me get.
Thank you very much. That's all the time we have. But Ramin will be out in the lobby.